In this video, we will be seeing about the pelvis, in which we will cover about the boundaries of pelvis, structure of pelvis, various diameters of the pelvis, and some joints in the pelvis, and finally different shapes of pelvis using Caldwell and Molloy's classification. Firstly, as we all know, pelvis is a very important structure which forms the passage for the childbirth. And the pelvis is divided into two parts, true pelvis and the false pelvis. This division is by the linea terminalis. We will see what linea terminalis is a little later. So, the linea terminalis divides the pelvis into true pelvis and the false pelvis. The part of the pelvis above the linea terminalis is called as false pelvis, which is also called as pelvis major, and the part of the pelvis below the linea terminalis is the true pelvis, which is also called as the pelvis minor. So, now what is linea terminalis? The linea terminalis is a line formed by joining the upper part of the sacral vertebra which includes the body of sacrum, the ala of sacrum, the sacral promontory, and the arcuate lines of the ilium and the pectineal line of the pubis. So, the linea terminalis is formed by the line joining the upper part of the sacrum, the arcuate line of the ilium, and the pectineal line of the pubis. So, this image shows the linea terminalis. This is the linea terminalis formed by the upper part of the sacral vertebra, the sacral promontory, body of sacrum, and the ala of sacrum, following which is the arcuate line of the ilium, and then there is pectineal line of the pubis on either side. This forms the linea terminalis, above which is false pelvis and below this is the true pelvis. Uterus is present in the true pelvis. So, this is the linea terminalis. Now, coming to the structure of pelvis, the pelvis is almost cylindrical in shape, and so the pelvic cavity, to be particular, is cylindrical in shape, which extends from the brim, that is the inlet, to the outlet. So, this structure, the pelvic cavity, is cylindrical in shape. And the unique point about the pelvic cavity is that in the upper part, the pelvic cavity is directed downwards and backwards, whereas in the lower part, it curves downwards and forwards. So, if this is the anterior and the posterior side, and this is the lateral view. The upper part it is downwards and backwards, whereas in lower part it is downwards and forwards. So this forms a curve, and this curve is called as curve of Caras. The pelvis is divided into three parts: the pelvic inlet, the pelvic cavity, and the pelvic outlet. The inlet, as you have seen already, is bounded by the linea terminalis, and the outlet is bounded by the line joining the lower part, that is the lower end of symphysis pubis till the ischial tuberosities and extending backwards to the lower part of the sternum, the lower part of the sacrum and the coccyx. So this is the pelvic outlet, and in between the inlet and the outlet lies the cavity, which is cylindrical in shape, as we have already seen. Now coming to the diameters of the pelvis, which we will see in the inlet, the cavity and the outlet. So first let us see about the dimensions of the inlet, in which we will see about the anteroposterior diameter, the transverse diameter, and the oblique diameter, which includes the right and the left oblique. This is further, the anteroposterior is divided into three. One is obstetric conjugate, then the diagonal conjugate, next comes the anatomical conjugate. Obstetrical conjugate, diagonal conjugate, and the anatomical conjugate, in which the obstetrical conjugate is the most important one, because this is the shortest diameter through which the presenting part should pass during the time of labor. In this picture, if this is the pubic symphysis and this is the sacral promontory, the distance between the sacral promontory to the upper portion of the inner surface of the pubic symphysis, this is the anatomical conjugate, which measures about 11 centimeters. So the distance between the sacral promontory and the upper portion of the inner surface of pubic symphysis is the anatomical conjugate, which is also called as true conjugate. Next will be the obstetric conjugate. The obstetric conjugate is the distance between the sacral promontory to the nearest point on the posterior side of the symphysis pubis. So this will be the obstetrical conjugate, which will be around 10 centimeters, and as we have already seen, this is the shortest diameter through which the presenting part of the fetus should pass during delivery. Next will be the diagonal conjugate, which is the distance from the sacral promontory to the apex of the pubic arch. This is the diagonal conjugate, which is about 1.5 to 2 centimeters more than the obstetrical conjugate. So, this is around 11.5 to 12 centimeters, and this is the diameter which is clinically measured by bimanual palpation. So, diagonal conjugate is the one that we measure using bimanual pelvic examination, which is 11.5 to 12 centimeters, that is 1.5 to 2 centimeters more than the obstetrical conjugate. So, to find the obstetrical conjugate, we need to subtract 1.5 or 2 centimeters from the diagonal conjugate. These are the three anteroposterior diameters of the inlet. Now, coming to the transverse diameter. The transverse diameter is the greatest distance between the linear terminalis on either side, which is about 13.5 centimeters. Then will be the oblique diameter, which is from the sacroiliac joint of one side to the iliopectineal eminence on the other side. For example, if it is right oblique diameter, it extends from the right sacroiliac joint to the left iliopectineal eminence, and similarly if it is left oblique, it is from left sacroiliac joint to right iliopectineal eminence, and this measures about 13 centimeters. So, in this diagram you can see the transverse diameter, which is 13.5 centimeters, and the anteroposterior diameter, which is the obstetrical conjugate or the anatomical conjugate, around 11 centimeters. Now, coming to the dimensions of the pelvic outlet. As we have seen in pelvic inlet, the transverse diameter will be the maximum diameter than the anteroposterior diameter, whereas in pelvic outlet, the anteroposterior diameter will be the maximum among all the diameters. So, in case of outlet, we again see three diameters: the anteroposterior diameter, the transverse diameter, and the posterior sagittal diameter. The anteroposterior diameter here will range from 9.5 to 11.5 centimeters. Transverse diameter is around 11 centimeters, and the posterior sagittal diameter, which is nothing but the distance from midpoint of the line between the ischial tuberosities and the external surface of tip of the sacrum. So, the posterior sagittal diameter is the distance from the midpoint of the line joining between the two ischial tuberosities and the external surface to the tip of the sacrum. This is usually more than 7.5 centimeters. These are the dimensions of the outlet. Now, coming to the plane of the least pelvic dimension, that is the mid pelvis. Which is the least pelvic dimension. So here the most important diameter will be the interspinous diameter, which is the diameter between the two ischial spines, which is the smallest diameter of the entire pelvis, which is around 10 centimeters. Next will be the anteroposterior diameter, which is around 11.5 centimeters, and then the posterior sagittal diameter, which is about 4.5 centimeters. So this is all for this video. We will continue about the classification of pelvic shapes, their clinical significance, and the abnormalities of the pelvis in our next video. Thank you.